Zoom link and then getting it streamed. So thank you. Appreciate that. Great help. So Teresa, to get started, do you want to talk about the amendment that our committee is putting out on the bill from yesterday?
I said yes to my mute self.
It's all right. I thought maybe we'd get started with that and then open it up to any other legislators who have any legislation or bills that they wanted to talk about. So.
Okay, just a second. Yeah, just a second. I'll be right back with you. 1 second. I wanted to make sure I had the right bill number. Okay. All right. So yesterday, House Commerce presented Bill H-627 that talked essentially about one of the items, I should say, was about broadening the types of financing that could be offered by VITA for different types of services and programs. And one of the things that was in the amendment was expanding the ability for VITA in consultation with VHFA to provide loans to assisted living facilities. And so my ears went up and I said, oh, but what about the other types of facilities that serve older Vermonters? And so anyways, long story short, I will be offering an amendment this afternoon that everyone from our committee has signed on to that broadens the ability to all licensed facilities for the state, all licensed residential care facilities for the state. So it includes nursing facilities, residential care, homes for people who are terminally ill, and one other one that is escaping me off the top of my head. In addition to independent living facilities, which are not governed or licensed by Dale, but they would have to be as part of one of those more advanced care facilities. So in other words, a standalone independent living facility would not be eligible, but one that is attached to or is part of a program that is being offered that goes from independent living to maybe assisted living to a nursing facility, you know, that kind of continuum of care. Those types of programs would be eligible. So I'll be offering an amendment this afternoon on that.
Fantastic, thank you. Just trying to raise the awareness in all our committees here that older Vermonters issues, and sometimes, you know, you'll notice stuff come out on the floor or get through committee and you're like, wait a minute, we should probably make sure older Vermonters are represented in that. So good job catching that, Teresa. Thank you. Good stuff. I just want to, before we get started here, I see Evan just jumped on. Evan is a UVM intern who's be working with me, Teresa and I this session. So welcome, Evan. I'm sure you'll start seeing him show up more on these Zoom meetings. So I noticed that Jessica's here and Chip. I don't know if you have anything you wanted to bring up before we get started.
I could briefly talk about 157 that I'm reporting on Senate amendments this afternoon.
Yeah, just a short little overview on how that might impact older Vermonters.
That's what I'm thinking of. Okay, so this is a consumer protection bill, and in particular, we need help from senior citizen centers and area agency on aging and various places. It will create a list of reliable contractors that will be kept by the Office of Professional Regulation. Now, the way this would work is the word needs to get out that this list, if this passes and is signed by the governor, it will create this list. So we need to get the word out that the list exists, because when my experience in working in the public defender's office for a lot of years was that consumer construction fraud is often targeted to elderly, disabled Vermonters who are more trusting. And when some nice man comes to the door and says, you need a roof on your house, I'll take $5,000 down and we'll put a roof on and then never to be seen again. So, this is the Senate thought that this created an issue for Vermonters on it. So the important piece about this is we'll need to get the word out if this list goes through, because it will allow Vermonters to go online and or contact the Office of Professional Regulation and find a list of and they'll have a certification program also, but a list of contractors that have not had any complaints adjudicated against them, therefore would be reliable, and they'd be able to contact them for home improvement work that they have to do. So very important, and again, really associated with older Vermonters because they're more trusting and are often targeted by home improvement scammers. Thanks, Dan.
Great, thanks, Chip. And what's the bill number on that again?
That bill number is H157.
Great, and that will be on the floor today. So
yes, I'll be reporting on amendments that came from the Senate today, and
all right,
it will go back to the Senate, and hopefully it'll get to the governor's desk shortly.
Okay, great. And there was just on the chat, Teresa, the bill number that the amendment is on, it's 5 something, right? I believe it's a committee bill. Do you happen to have that in front of you? I can look it up, put it in the chat.
It's H627.
Oh, 6, okay. Great. Thank you so much, everyone. Thank you for those updates. So let's just get started. Today we have Laura Pelosi and Jill Olson joining us today to talk about the workforce, issues in workforce. So I'll just turn it over to them. Thank you so much both for being here today. Really appreciate it. Thank you.
Yeah, thank you so much for having us. Just for those of you who might not know me, I think I know most of you from what I can see in terms of names on the screen, but I've represented the Vermont Healthcare Association for a really long time. That's our trade organization for all of our licensed long-term care facilities, including the skilled nursing facilities, residential care homes, and assisted living residences. So I've been doing this work on their behalf for more than a decade, and maybe I'll just kind of set the stage a little bit and then turn it over to Jill, and maybe we can talk a little bit about what we're hoping to achieve this legislative session and the things that are kind of important to us from a workforce perspective. Back in 2019, I'm going to take us back. It's hard to believe we're in 2022, but back in 2019, the legislature established the Rural Health Services Task Force, and Jill and I both participated in that task force over the course of almost a year. I had the great pleasure of chairing the workforce subcommittee. What was clear at that time is that universally, everyone on that task force recognized that our workforce shortages were the greatest threat to our sustainability as a healthcare system, and by that I include long-term care. So, we prepared a number of recommendations for the legislature that came in January 2020, and the legislature took immediate action on a number of those items that year to address some of the more low-hanging fruit challenges around barriers to licensure. We set up a nurse scholarship program. So the legislature really took steps. Even though the pandemic hit us like halfway into the session, the legislature took some great steps to address, what we identified at that time as a critical need for nursing-related positions. And in that, I include our RNs, LPNs, LNAs, and our non-licensed personal care aides as well. And at that time, we were estimating a need for about 5,000 of those folks to enter our workforce. COVID has severely exacerbated the current workforce shortage. I get a little bit concerned when I hear some messages out there that, this predated the pandemic. There's nothing we can do. Like, it's just a matter of time. We've had a nursing workforce shortage for years and years. The pandemic has exacerbated. We are, as a group of long-term care facilities, really challenged to continue to admit residents because facilities have to have the staffing that is necessary to care for residents and patients. That's having a financial impact on facilities. If you're, not serving residents, your revenue is declining at that same time. The labor costs have increased to extraordinary levels, both to try to recruit and retain permanent employees.
Laura, you're freezing up. You're actually officially
and
frozen.
The need to by Jill.
Laura,
I don't know why.
Laura?
I can't. Yeah, can you see me?
Yeah, you were just
there you go.
were just freezing
for
up.
a bit.
And here I am in Montpelier, back in my
I was
office.
just gonna say, she's a stone's throw from the state
First
house.
time in
I have
2 years.
to know.
Yeah. So I'm right next door. Am I still frozen?
No.
Okay.
No, we can see you.
Okay.
If it's any consolation, the State House isn't doing any better in terms of connectivity here. Oh, now you're frozen again. You're frozen again. Maybe turn off your video and let's just.
Let me turn off the video. How's that? Any better?
Mm-hmm.
Okay, so we'll go with no video, which is probably better for everybody. So, so at the end of the day, the COVID pandemic has exacerbated the workforce shortages. It's increased labor costs significantly for long-term care facilities, both to recruit and retain permanent staff, as well as the need to have to use very expensive traveling staff. It's created real patient flow challenges for hospitals who are unable to discharge their patients to our long-term care facilities, particularly for subacute level patients in our skilled nursing facilities. I'm sure you'll hear a similar concern from Jill on the home health side. So it's created a real capacity crunch because we do not have the workforce that we need to take care of residents and patients the way we would like to in our long-term care facilities. So I think you've probably heard Senator Sanders, recently talking about the need for 9,000 nursing-related professionals. It's a really scary number, and we've got to take as many steps as we can possibly take to start to make a good dent in this problem. I don't want to spend a lot of time focusing on sort of the day-to-day challenge of trying to run facilities when you have such a workforce shortage that you're dealing with. But I think it's really important for this caucus and for legislators to highlight the needs for this sector when it comes to workforce. And we are supporting the Agency of Human Services Healthcare Workforce Strategic Plan. You will see, I think, in the tax package and the budget, some of the elements of that strategic plan reflected. In particular, in H527, which is the tax bill, it includes a nurse tax credit, a nurse tax credit proposal, which is important from a workforce development perspective. I started to run through the governor's budget proposals this morning. I have a long list of things to work my way through, but I do see that there is some additional funding for nurse scholarships and loan repayment, also critically important to help us from a long-term perspective. I think something I really want to put on your radar screen is that providers really need some funding for recruitment initiatives and for provider workforce pipeline development programs. They really need access to some funds to help with their recruitment and retention initiatives. And to answer Ruby's question, access to some of those recruitment funds would help on the PCA piece from a recruitment perspective, from a training perspective. So we really think that's a critical piece that we need to see, hopefully coming out of this year. There is an expansion of the earned income tax credit in the governor's proposal as well, which would be a benefit to our lower income workforce. And that's something that we had identified as part of the Rural Health Services Task Force a few years ago. We weren't really quite sure how to implement that in a way that maximized the individual's full employment opportunities. So I think it's great to take a look at that in terms of how it might help our personal care attendant folks as well. So I'm going to leave it there. I think one other thing I'll note is I did see some, rate increases for our home and community-based service providers. I believe it's a continuation of the 3% rate increase from last year. And then the statutory inflation for the nursing homes, all critically important. These providers need as much funding as possible coming into fiscal year 23. I think we are just now starting to see the ripple effects of this pandemic from a financial perspective on our providers. And so as much financial support as we can provide to them, I think is critically important. And I'm going to turn it over to
Jill Olson. Do you remember me?
Well, I'm looking at my notes because I had some other things in there, like, for example, the remote worker program. There are some proposals around making some changes to that grant program. And I hope that legislators are thinking about prioritizing this sector when it comes to any types of programs like that. It's really important, I think, when we're looking at workforce development programs to prioritize this sector. And so we'll be on the lookout for those kinds of opportunities and letting you know if we think there are opportunities for that. But we'd ask for your support there. And again, I just see a lot of in the governor's budget proposals from yesterday, some investments in tuition assistance for nurses. So I think those are all great things for us to be looking at. Jill.
Thank you.
Great. Hi, everybody. Dan, should I just launch in, or do you want people to ask Laura questions? Should I just launch in and they can ask us both? How about if we do that?
Yeah, if someone has a specific question, we'll catch them at the end. Sounds
Okay.
good. And I do see some stuff in the chat, so definitely.
Great. So hi, everybody. I'm Jill Olson, and I am the Executive Director of the VNAs of Vermont, so representing home health and hospice. And I always like to remind people what home health and hospice agencies do, just really briefly before I launch in, because sometimes people forget our multiple roles. But we provide, the two I'm going to talk about today, we provide skilled care at home, skilled medical care at home. So a nurse or a therapist in your house when you need care, either to prevent you from going to the hospital or because you've recently come home from the hospital or from rehab. And then we also provide at-home long-term care. So that's not a skilled service. That not generally provided by a nurse. That's the things that people need in order to function independently every day. So help getting out of bed, bathing, dressing, those kinds of things. So we provide both of those types of services. And sometimes I think people conflate what we do. Some things to add to what Laura said. Well, first of all, when you're thinking about home health, this is how I think about it. Everybody we take care of is a person who would otherwise either probably need to be in the hospital or need to be in a facility. And so the role that we're playing is the 6,000 to 7,000 people who are on our service every day across the state are people who are not using those really scarce resources. Thousands and thousands of Vermonters every day. So our role is quiet, it is hidden, but it is also essential. There are people who have COVID right now who have never been to the hospital, but who are getting care at home from home health. There are people who have been discharged who have COVID, and this is since the beginning of the pandemic, who are taken care of at home. And then, of course, all the other myriad of needs that people have. I really appreciated what Laura said about how she gets worried about people talking about the, that we had a workforce crisis that predated the pandemic. So I'm concerned about that too. We absolutely did. But I also worry about people who think that we have a workforce crisis that was caused by the pandemic. I think exacerbated is the right word. We were fragile going in, and we're in worse shape now is how I view it. So I've recently collected data from home health agencies. We are missing 1 in 4 nurses, that's at all levels combined. We are missing 1 in 3 personal care attendants. So those are positions that are not filled. And so every day on the ground, agencies are trying to figure out who needs services right now today to make sure that those critical needs are met. So far, we have not become part of the discharge capacity crisis for hospitals, but we might with this particular surge because it's affecting so many staff. So we're more worried about that than we've ever been. I want to also say that I think many of you know this, but we are working in a coalition that Ruby Baker is heading up. So she's on the call. So I just want to acknowledge that. Many folks on this whose faces I can see are in that coalition, and we're really trying to advocate together for the long-term care system in particular, for funding and for the workforce items that Laura was talking about. So I just want people to know we're working in those groups. And then just a really practical point, I'm trying to understand that 3%. I need to dig into the budget more. I think it's just, I don't think it's a new increase. I fear that it's not a new increase, right? It's a continuation, it's funding. So what we saw in the ARPA budget over the summer was it's funding over 3 years for last year's increase. That's what I think we're talking about. In other words, is that right? Yeah.
That's how I'm reading it. Yeah.
Yeah. So I just want to make sure people understand this is not a new increase. This is every increase costs money in perpetuity. And this is using federal dollars this year to fund last year's increase. It's not a new increase. And I want to be clear, there is no year when we don't need an increase. And this is certainly not it. So I just want to make sure that people don't get confused about what that 3% really means, because that's how I understood it.
Can I ask a question while you guys are doing it? So we had a presentation on the federal matching, the FMAP bump as it's being referred to, which I think is what you're referring to. So in that proposed use in the Budget Adjustment Act, it appeared as though the administration was budgeting for using that temporary FMAP bump for 11 quarters of the 3% increase that was approved in the budget year that we're in right now. And so is what you're saying that that's just is essentially noting that in this year's budget, it's not an additional 3% increase.
I think that's what it is. Yeah. So because that's how it was described in the ARPA plan for spending those dollars. So it was a one-time, so it's an increase that was made last year that has a cascading effect into the future. And so they're using those FMAP dollars to fund that increase for the 3 years that they can use those dollars. But it's not a new increase. That's how I understand it. I want to be clear. I'm happy to be corrected if I'm wrong, but that's how I understand it.
Yeah, no, I don't know that you're right or wrong. I just that's helpful to know that that's how you're interpreting it. And we need to dig further into that, because what we really need to do is to add to the 3% increase, and we actually need to build the 3% increase into the base budget. And I believe, my position is that we should be building last year's. I keep saying last year's, but it's the year that we're in right now. The 3% increase that was allocated for rates this year should be built into the base budget now. And while there is funding to do it, frankly, and not forestalling that for 11 quarters doesn't make sense to me. So if that's in there, that it is going to make it probably a higher climb to get an additional increase this year, because it appears as though it's an increase when it's not really.
That's exactly what I'm concerned about, that it looks like an increase that it isn't.
That's my concern as well. And another piece that I didn't see, and again, I haven't made my way fully through the budget, but we've been working with Dale and Diva on new rate methodology for ERC and ACCS, and of that built in.
Yep. we're also, I mean, just to say there are some good spots too. So while I'm raising this concern about that 3%, I just want to also note that we really appreciated the increase in the moderate needs rate in the budget adjustment. And also home health is moving into a rate schedule where they're trying to get us closer to Medicare. We're still, I think, at about now 82% of Medicare. That's the skilled side. But we really appreciate that we're making progress on that front. I can't tell actually what the budget does on that yet. I haven't sorted that out, but we did see a January 1 increase that's already been proposed through the DEBA process. So I do want to note where the bright spots are.
Yeah, I don't know if folks heard me on the ERC ACCS rate methodology. I moved. I hope I'm in a better location for internet service, smack in the middle of Montpelier here.
Oh my goodness.
And to think I've been working from home without great internet for 2 years and haven't had this trouble. But so I'm hoping at least the Human Services Committee can ask Diva and Dale to come in and present that rate methodology for ERC and ACCS so that you have an understanding of the great work that's been done and the actual need for those providers in terms of a reimbursement perspective. I think that would be great if it turns out, and I think I'm right about this, that it's actually not contained in the FY23 budget proposal. So that would be certainly a step we would appreciate.
Yeah, it's tough to talk with certainty about the budget on Wednesday when it was produced. Yeah, came out. We were still figuring it. It's a lot to sort through.
Yeah.
And it's not even on our schedule yet. So it will probably be next week when the Human Services Committee starts seeing presentations from Dale and Department of Health and everybody. So definitely looking forward to hearing what's in there and how, where the money is. So thank you. Great input. I did notice though, there was money in the, there was money for 153 in the budget adjustment for DEVA to look at the rates. So that's a good sign. That means that there's, when Rep Wood and I went to Senate Health and Welfare, they were asking us where the money would come from, and it's in there. So fantastic. Good, moving that bill forward as well. Does anybody else have any comments or things they want to bring up on this particular subject or questions?
Oh, did I mention our travelers? I think I forgot about our travelers. I just wanted to remind everybody, home health is in traveler crisis. Also, we've doubled our cost of contracted staff since 5 years ago. And I surveyed agencies last week, and we're actually in 21, they were about $3 million over budget, what they expected. And, if that's a big number in home health,
I was gonna say, I'm gonna give you a scary number. So our estimate for calendar year 2021, so January 1st, 2021 to December 31st, 2021 for just skilled nursing facilities were about $40 million expenditures in traveling nurses. It's completely unsustainable. Yeah. And that's why investment in the long-term care workforce is so critically important. And Medicaid is their single biggest payer. So we've got to find a way to move off of this frightening train that we are all on.
Jill, do you know what the total amount for the VNAs is for travelers? You said 3 million over.
Yeah, it's about in 21 it was about $8 million.
Okay, thank you.
Yeah.
As you know, Senator Sanders is tracking a lot of this, so the statistics are really helpful.
Yeah, and it was 4 million 5 years ago, so it's it's a big jump.
Thank you, Molly.
Thank you. I want to thank Laura and Jill so much for sharing about this today, and Representative Noyes and Representative Wood for bringing this topic here. It was such a great turnout, and I just want to add that Cathedral Square, where I work, we have a 2 assisted living, licensed assisted living facilities. And I just want to, you know, and I know Laura mentioned this as well, that it's not just nursing homes, it's the whole continuum that is struggling with workforce. But I just thought I could put a finer point on it by, you know, explaining that, you know, when our assisted living administrator is, you know, putting together the schedule for 2 weeks, because we do our staffing schedules in 2 weeks, trying to fill 24/7 slots. She's regularly, after she's put in all of our existing staff, available staff, she has about 25 to 30% slots unfilled. And that's when then she turns to the traveler nurses, the asking people to do more overtime, that the whole thing just filling in the gaps. So it's, you know, it's just an extreme situation right now. And I would also say that when we look across the types of positions at our 2 licensed assisted living facilities, our biggest shortages, and we could just be lucking out right now, but our nursing positions, RN positions are filled, but we're struggling the most with the what we call resident assistants or personal care attendants. So we really, and that's where you have a lot of quantity of people, because they're doing the day-to-day, they're doing the bathing, they're doing the direct caregiving. So I just want to make sure that it is put out there as well. So thank you very much for this discussion.
I really appreciate Molly's, you know, sort of giving a little bit better on the ground picture. I mean, I think an important thing to note here is that it's all hands on deck in all of our long-term care facilities every day, all day long. That's administrators delivering trays. It's, you know, administrators helping to, you know, clean the facility. And I mean, everybody is working as hard as they can. Everybody is working more hours than they should have to work to get the job done. And, you know, they've dealt with, you know, significant numbers of COVID, you know, cases over this last, coming into our 3rd winter. So the stress and burnout for these folks is real. So that's why we need your support on workforce.
Great, thank you. Jane, I see your hand up.
Thank you. Thanks, Jill and Laura, for this update. And of course, in the area agencies on aging, we are referring to home health and our partners in the community. So when the workforce is impacted, our care management teams, you know, are struggling as well to manage their clients, to be able to wrap around or organize those services on behalf of them. And because the workforce challenges, and as Molly was saying, you know, whether it's home care aides or PCAs, LNAs, sort of that level of service that is provided in the home is just not available. So, you know, it starts to create all of this trickle down concern. Our goals are to keep our clients in their homes so that they don't have to be referred to, you know, other care settings, hospitals, whatever the case may be. So you can see how this is all integrated in a very difficult way when the workforce is challenged at every turn within our communities. So I really appreciate hearing those details. We're feeling it definitely, and we have the utmost support and respect of our colleagues in home health and long-term care facilities who are trying to manage through it. But another perspective for everyone.
Thank you. Thank you. Jim.
Thanks, Dan. So I was curious from where Molly mentioned that after filling the 2-week schedule that finding 30%, I would say that we have a similar experience within the Living Well group, which is residential care. I'm curious if maybe Laura or Jill or maybe Molly has a sense of what that absence of 30% costs the healthcare continuum. In what is the overage that it impacts? Because I know for the facilities that I work with, it's huge. I'm just wondering if anybody has some sense of the number statewide.
So when you say overage, I guess I'm not quite sure I understood your question. I mean, we know that if we're trying to fill, frankly, 30% or more is more likely 30% or more of positions usually using travelers. We know the cost is anywhere from 4 to 6 times, where you'd be, depending on whether or not it's a crisis rate or if it's just a standard rate, right? So we know, and you can see that, I think, very much reflected in the statewide nursing home expenditures on travelers. So that's one way to sort of capture the scale of what we're talking about. But I'm not sure I fully understand your question.
Yeah, I mean, it's really hard to calculate the cost of something that isn't happening. So we know the cost of what we're doing, and we also know that it's certainly less expensive for people to get care, say, at home than it might be in a hospital or a nursing facility. At the same time, I think what's happening is a lot of people aren't necessarily getting services at all. So, or their family members are the ones who are taking care of them. So I don't really think that I think the question you're asking would require a level of analysis that someone like me is not really qualified to perform.
Yeah, well, that's really where I'm getting at, is to really underscore the 4 to 6 times cost. Really, that if I had the staff to fill those positions versus having to go out and get travelers, the reason I think that analysis is critically important, and not just for Vermont, but across the whole country, but specifically we're here for Vermont, is that if we don't get a handle of that 4 to 6 times, we move from an acute type of solution to a chronic solution. In other words, right now the travelers that's an acute solution that says, okay, well, people from New York will come to Vermont who might have had a permanent position in New York, get a better pay, and the companies that hire them as travelers get a benefit. And then they come to Vermont. Vermont has the problem of the people standing next to them who've been permanent, but see that there's a better money in doing traveling. So do the permanents go to New Hampshire? Just an example, but that becomes an interesting problem. But if not analyzed and not understood, that we're talking about 4 to 6 times cost differential between the permanents versus having to do this solution. And if it just becomes the norm without being focused upon, it becomes chronic, and the healthcare cost across the continuum becomes a much, much more expensive thing. So I'd like us to be aware of that.
Yeah, no, the difference between the cost of an employed person and a traveler, that is probably knowable. I thought you were asking something different. Yeah.
I think, to be clear, we've got our eye on that very target, right?
Yeah.
And so here's the problem. We're going to be using travelers until we have a sufficient and adequate supply of workforce, right? And that's why these workforce investments are so incredibly important, right? We need funding to retain our existing folks, which thankfully to the House, there's funding in there in the budget adjustment. So that's a critically important piece. We also need funding to help with recruitment and with workforce pipeline development and training programs. The challenge is those are longer term solutions.
Yeah.
None of that is going to happen overnight. And so in the interim, until we are able to build that workforce, we're kind of stuck on the traveler train.
Right, because we got to take care of people. Got to take care of people, right?
Yeah, that's why I wanted to underscore it.
Mm-hmm.
Thank you.
Great, thank you. Ruby.
Hi, yeah, I just wanted to share a little story that I actually heard today from someone who was at my house helping with something. She was telling me about her daughter, who is an LPN and an LNA, and her daughter was talking to one of the travelers, and the traveler was saying to her, oh, we love coming to Vermont because we're getting paid more here as travelers than we are anywhere else. And I think that further highlighted to me just how in crisis we are, that Vermont is not only paying a lot for travelers in general, we are paying more than anybody else for travelers. And that, you know, further highlighted too for me that part of this solution really has to come from the federal level. Like there has to be some regulation about how this happens. And the other thing I wanted to recognize, because no one has explicitly said it yet, but it's part of what we've talked about in our coalition. There are workforce challenges in every sector across the state right now. And so one of the things we hear again and again is, oh yeah, join the club, we're working on workforce. And we wanted to just further highlight that our workforce issues in long-term care are significant and important in a different and more extreme way than workforce challenges in many other sectors, because we can't close on a Monday if we don't have enough staff. It's not possible. People need those hours of care on every day. That is not feasible. And so when we're talking, it's not just don't hire the travelers, don't pay those people as much. We absolutely have to have bodies in the building. It's not safe. People die. People are harmed when we don't have adequate staffing levels. So we have to pay it. And so we are held hostage to whatever rates are being asked and demanded. We are held hostage to the workforce crisis in a way that other sectors are not. So I just want to highlight that.
Ruby, I really appreciate that. And usually when I'm presenting to committees, one of the things I say is healthcare is different. You know, we can't put in a kiosk like a retail entity can, right? You know, these are things that actually require people at the bedside to take care. It's people taking care of people. And I think you make an excellent point. And these are 24/7 operations with no choice, but to be there for the people that they're serving. So I appreciate that comment greatly.
Yeah, great points. I didn't see if Josh or Meg was up first, so I'm going to give it to Meg. I didn't see which hand went up first, but Meg.
Thank you so much, and thank you everybody for digging so deeply into this. And I just wanted to touch base and kind of echo something Ruby said, and also was mentioned by someone else. And I think that we're really struggling to even see the full picture of this. Like, we know it's a crisis, but there are so many unpaid caregivers that are at home and just dealing with taking care of people right now. The wait lists are so long, we're not even seeing the full pressure of this. And I just want to sort of reiterate what Ruby said, in that people are suffering. People are really, really suffering, both older Vermonters who aren't getting the care and attention they need, and their family caregivers who are primarily women who are either out of the workforce and suffering the financial implications of that for themselves and their children, or trying to do a job and care for a person, a parent probably, or a spouse that they love, who needs them 24/7. And so I know that's not connected directly to the financial pieces you're talking about, but I want you all to have that in your heart as you're thinking about this issue, that it is more than just fixing the situation there. As we find the staffing and we increase the space, we will increase pressure all the way down the system, and we will improve many, many, many Vermonters' lives. So right now the estimate is 25,000 unpaid caregivers. I'm sure that is below what the actual estimate is. And that's only for Vermonters with Alzheimer's or another form of dementia. That's not all Vermonters there's many older Vermonters that have other caregiving needs. So this is not a small problem. It's a real problem. And I just want to thank everybody for just taking the time to really understand how critical this is and why we have to address it right now.
Great, thank you, Meg. Josh?
Yeah, I just unmuted myself. Okay, good. Yeah, but just to highlight in that, so here at Green Mountain Support Services, we provide similar services with our shared living provider program, and very similar to those situations. And we've seen some of the challenges. Just to kind of echo that other point, is one is we've made it clear that we don't call our personal care attendants and stuff, we don't call them angels or heroes, because that gives us permission to pay them less. It's a profession and it needs to get paid as such. The other thing too, looking at the statistics, the poverty, the poverty line right now we have in Vermont on their standard of living is $14.89, and that per hour. That means if somebody is single living by themselves. So when you add it into being a single mom or single parent, or people who have children in their household, the minimum requirement they need to get paid is close to over $20 an hour. That's just to make sure they can pay the bills. And the other challenge we also see too, and this is something that we feel it, but we don't talk about it enough, especially in the healthcare industry, is people are leaving as well because of compassion fatigue. They're not paid enough. They're not paid enough to actually be able to turn off and care for other people when they have to worry about, did my kid just get COVID and what's going on? And I get all these other things happening at home, that when you ask them to start caring for other people, they have to balance their own peace of mind and mental health to how much I'm getting paid. So that's the other challenge that we're faced, is those 3 points. Is like, it's a profession and it deserves to be treated as such. And also it's a hard, mentally draining work, that the work that we provide. So
that's for sure. Thank you. Anybody else for some last comments before we break and head back to come here? So, all right. So this actually works out pretty good. Next week, we're going to be talking about engaging older Vermonters in the workforce. So I put a link in the chat to an article that was came out in the in Digger, and Glenn McRae, who's here with us today, is going to be one of our guests, as well as folks from the Vermont Chamber. So bring your great ideas on next week. We'll be talking about how we solve some of these problems. So maybe we could at least take a little bit of it. Teresa, anything you'd like to add here?
I'm all set, and just want to thank our guests today, like you did, and thank everybody for participating. This is, we have a long hill climb ahead of us, and we all need to be there for the polls. So thank you to Jill and Laura in particular for being our speakers today. And we look forward to partnering with everybody here to move forward the resources necessary to provide this important care for Vermonters.
Great, thank you. All right, thank you everybody for coming this week, and hopefully we'll see you all next week.
Thank
Have a
you.
good one.